Your heart is a masterpiece of timing, a perfect rhythm, keeping you alive, second by second. But when the drummer goes rogue, the music goes haywire and could be deadly. One question, two warriors, blood thinner versus Watchman. In the fight to prevent stroke, who saves the day? Today, we settle the debate. The pill versus the Watchman.
Hi everyone, I am Dr. Joseph Gnanaraj. This is Dr. Logic 360, where your health gets smarter and simpler. Today, we are going to talk about atrial fibrillation, why a Watchman device is used in atrial fibrillation, and the big question, is the Watchman device always better than medications? Let's dive in. Imagine deep inside the top of your heart lives a lead drummer. Doctors call him the sinus node. His job is to set the rhythm of the heart and make the heart beat in a regular fashion. When the sinus node is in control, the heart squeezes like this. Lub, dub, lub, dub. When the band hears his beat, they play perfectly. Your blood also flows smoothly inside the heart. But in atrial fibrillation, suddenly a bunch of copycat drummers jump onto the stage and start beating the drums. So the concert goes crazy and comes to a standstill. So the heart has four chambers, two upper chambers called the atrium and the two lower chambers called the ventricles. In atrial fibrillation, the top rooms stop squeezing. Instead, it quivers. Inside the left atrium, there is a little extra pocket called left atrial appendage. It's like the heart's attic where the junk collects. When the heart jiggles or quivers, blood sits in that attic and turns into clumps called clots. If that clot falls out of the attic, it rides the blood highway straight up to your brain. It blocks the road, traffic stops, that is a stroke. And strokes are very serious business, right? Nobody wants a stroke. So how do we stop it? We have two main superheroes. Superhero number one, blood thinners. We commonly use medications called apixaban or Eliquis or Xarelto or rivaroxaban. These are special pills which thin your blood and make the blood slippery. If the blood is slippery, it can't stick together and cannot form a clump. So problem solved. Stroke is prevented. But super slippery blood or thin blood means if you cut yourself anywhere or have an accident, you can bleed a lot more than usual. Some people really can't handle that risk. When patients taking blood thinner fall and hit their head, there is also risk for bleeding in the brain, which could be catastrophic. So that's when the superhero number two enters, the Watchman device. Remember that little attic pocket where the clots reside, the left atrial appendage? The Watchman is like a tiny umbrella or a cork. Doctors slide it into your heart and plug up that attic door. Boom, the door is sealed. But patients with Watchman need to take aspirin lifelong. Okay folks, pay attention here. Two big new science reports just came out that surprised a lot of doctors. Report number one is about aspirin. For a long time, people thought, hey, blood thinners are scary. I'll just take baby aspirin. It's safer. No, wrong. The new study, the Artesia trial, has showed that for atrial fibrillation, aspirin wasn't really safer. It caused almost as many bad brain bleeds as the blood thinners. So, aspirin is not the gentle backup plan we thought it was. This has major implications because patients with Watchman device need to take aspirin lifelong. Hence, Watchman device may not be the answer for patients with high risk of bleeding inside the brain, such as patients who are elderly with fall risk. Report number 2 compared the Watchman device against the slippery pills or the blood thinners carefully. Everyone thought the Watchman device would win easily, but guess what? It did not. In this specific study, the people taking the pills did just as well or sometimes even better than the people who got the Watchman device. It turns out good old-fashioned medicine is still really tough to beat. So here's the wrap up. AFib is a jiggly heart. It causes clumpy blood and blood clots leading to strokes. To stop strokes, most people need blood thinners like Eliquis or Xarelto, and they are still the champions. Aspirin causes more brain bleeds than blood thinners like Eliquis or Xarelto. Hence, Watchman device along with aspirin may not prevent brain bleeds and may cause more brain bleeding than the blood thinners like Eliquis or Xarelto. Thanks for joining me. I'm Dr. Joseph Gnanaraj for Dr. Logic 360, where your health becomes smarter and simpler.